Hi everyone. So this is gonna be my debate response post. I'm going to be responding to Maxwell Moncure's debate about how the WHO is not an effective tool in combating COVID. So, the first thing I just wanted to point out about that, was one of the points that Maxwell brought up was comparing like the WHO's response to the swine flu versus COVID. And one of the points that he made was with the swine flu, with the swine flu, when the WHO was involved with combating that in the United States, there were much more cases than we have cases of COVID right now. And I just want to talk about that and saying, so the swine flu was officially declared a pandemic from 2009 to 2010 by the WHO. So it was around for a little bit more than COVID of what we've had in the United States so far, that we know of at least. I mean, it could have been going on longer, but we'll say January-ish to now, which is a little bit less than a year, and swine flu was a little over a year. But so Maxwell pointed out that there were 60 plus million cases of swine flu, and that's accurate. And I looked it up, and there were a little bit over 12,000 fatalities from the swine flu in the United States, not the whole world, just the US. And I just wanted to point out that yes, like those numbers are accurate, yes. And compared to COVID right now, in the United States only, COVID, there have been around 12.3 or so million cases, but the fatalities from that have been over 256,000. Like, that's significantly more than the swine flu. And that being said, I just think that yes, while those numbers like are significantly different between cases and then deaths and fatality rate, honestly, I don't think it's that productive to compare it and be like, okay, we had way more cases when the WHO was involved, and so they shouldn't be involved now, because I mean, you could use that same argument and say we have so many more deaths now than we did with the swine flu. I mean, like, yes, the number is correct, but I don't think that it really, I don't want to say it doesn't matter, but like, I wouldn't use that as like a basis for deciding whether or not the WHO should be involved. And the question is it an effective tool? So I would say focusing specifically on COVID right now in the United States and across the world, not like what's happened before November, not what happened with the swine flu, whatever. I would say that the WHO, the World Health Organization, is an effective tool, because one of the biggest issues we're seeing right now in the United States, as we're like sitting and waiting for this vaccine, is just testing. There's not enough testing. And the World Health Organization, I mean, its role is to use its resources to mobilize and to provide mass testing and vaccinations, amongst other things. It's a very large organization. But in past pandemics, they've had great success with that all across the world, not just the United States. So I think the WHO would be a very effective tool for that specific purpose right now in helping us have more testing. And obviously, because the US isn't funding them right now, I mean, there's nothing we can do in this moment, but should we put that funding back into the WHO, they would be extremely effective in providing mass testing. And for other countries, I mean, they already are. I'm looking at what else I wrote down. Also, when we do have vaccinations available, the WHO will be extremely effective in administering those vaccines and just like providing more support to administer those, because I mean, the biggest thing with the vaccine is once we get it, it's not going to be effective unless it's easily accessible. And for a vaccine to be accessible, first of all, you need to have enough of the vaccine, which, I mean, we're kind of just waiting on that. But you also need the people to administer the vaccine. And the WHO would be extremely helpful with that because, I mean, again, one of the things that they're fundamentally prepared to do is mobilize and provide vaccinations. And then quickly, I just wanted to agree with Maxwell in saying that, yes, individual behavior is extremely important. I think that when it comes down to it, I mean, international cooperation is amazing, and I truly believe we do need it to combat this because it is a pandemic. It's not an epidemic. But when it comes down to it, we're all individual beings, and our behavior is going to affect the world the most. So I just wanted to agree with you in that respect, and like, if we can all just like stay home, wear our masks, stay safe, stop traveling, that's gonna do a whole lot for preventing COVID in our communities. But with that being said, I do think the World Health Organization is an effective tool, especially right now. If we just look at what's happening in the world right now with COVID, they would be extremely effective if we as nations like fund them and collaborate with them to bring them into our countries, because they are trained to mobilize and administer vaccines once we get them, but also provide testing. So thank you for watching.